This lecture will be talking about the types of drug antagonism. All right. We spoke about antagonism in the first time when we were talking about drug receptor interactions. Okay, where we said that there is antagonism and there is what agonism. All right, we could say antagonist, agonist. Okay, antagonist is basically a substance that will bind to a receptor and will not activate the receptor. And this substance will also prevent other substances that might have reactivated that receptor. Do you understand? So the antagonist will bind to the receptor, it will not do the job of activating the receptor, and it will still prevent other guys from activating. All right. So what are the different types of drug antagonism, or what are the different types of substances that actually can be an antagonist? Okay. So types of drug antagonism, right? So you could say this agonist, when an agonist comes to a receptor, it will activate, or it will cause the receptor to produce a response. Okay. But when an antagonist actually binds to a receptor, it will cause no response. Do you understand? So what are the types of substances that can actually cause no response when they bind to a receptor? All right, so types of drug antagonism. An antagonist could be a chemical substance, right? Then we term it chemical antagonism, all right? So if an antagonist is a chemical substance, we say that ionic binding that makes other drug unavailable. Do you understand? Do you understand the explanation? Or you could say that chemical antagonism is basically a chemical that will bind to a receptor and will not activate the receptor and will prevent other drugs from activating that receptor. All right? Because this is pharmacology. Everything we are talking about, we are basically focusing it on drugs. Do you understand? So we also have pharmacokinetic antagonism, or you could say drug interaction antagonism. All right? And this is when one drug is decreasing the metabolism of another drug, right? Or in other words, you could say that one drug is preventing the action of another drug. Do you understand? So that's drug interaction antagonism, right? Then we have a block of receptor effector linkage, right? So the receptor is supposed to be linked to the effector. Do you understand? Because the receptor will take up the signals and signal the effector to what elicit its effect, right? But if there's a breakage in this link, then there will be no effect, okay? So block of receptor effector linkage is basically interruption of the chains of events that will lead to the response by the agonist, okay? So physiological antagonism, and this is basically interaction of drugs with opposing physiological actions, right? So if a drug is supposed to activate the sympathetic nervous system, and the drug is coming to actually interact with factors that are what opposite to all those flight, fright, and fight. Okay, that's basically the sympathetic nervous system that is activating the body to become active. All right. So if the drug is interacting with factors that are turning to calm down the body, it will also affect the response of this drug, okay, or the response of the body to this drug, okay. So we're ending here by still defining the concepts of agonist and antagonist so that you guys should refresh your memory. Antagonist is basically drugs that occupy the receptor and activate them. That's agonists, right? Then antagonists are drugs that occupy the receptor and do not activate them, and they will also prevent other substances which are agonists from activating these receptors. All right. So, guys, that's it about the types of drug antagonism that we actually have. All right. So, bye for now.